So hello guys, we have Dr. Alben with us. Hello
Hi.
sir. Before we start the interview, could you please introduce yourself and share your experience with us?
So I am Dr. Alben and I am a clinician scientist. So I am a doctor, but who've taken up the field of research from the beginning. So I do a lot of research in the field of heart specialty, so basically cardiovascular sciences. And my specialty has largely been on preventive healthcare.
Okay.
And trying to see how we can help people prevent from having a heart attack or a stroke or any of those negative things that happen to people because of poor lifestyle.
Right. My next question is, how's your experience with hPod?
The experience, I should say, was kind of a deja vu, because I was thinking that why should people go to a clinic which is located at a particular location and has a lot of challenges from a perspective of getting there, parking your vehicle and all that. Why not have small units which are on its own able to deliver whatever the clinic is able to do? And that's when I came across hPod, and I was really happy on the concept level itself. Then when I experienced it, what I understood about hPod is that they have taken care to make sure that it meets all medical device grade. They are not health or wellness products, they're actual medical device grade products, which gives a very high level of accuracy. So I feel very confident that now people can actually walk into these hPod units and get a complete heart health checkup without the need of a doctor or a healthcare professional sitting. So that's been an experience. It's something which is standalone unit which can provide all the necessary parameters for a health checkup.
Well, that's great. My another question is, in what ways does the hPod stand out from other medical screening devices?
The first point is that it is comprehensive. Okay, it is not just looking at one or two parameters, because you see sometimes you see only blood pressure, you see only sometimes ECG, sometimes you see only body weight, and then you have devices which look at body composition. Now, if you look at the latest guidelines, people are talking about heart, kidney, and metabolism. And you need something that can actually get you all the three parameters in one. So that's where I find the comprehensiveness of hPod is what I feel is standing out. Second part of it is it's so much of a cost saving. Yes, you'll have to pay for a session, but imagine the amount of indirect cost that you're saving. You don't have to go and find a place for parking. You don't have to wait in some place to get a health checkup done. You can just walk into this machine, fill up your details, and do your entire screening with it. And I think the time-wise, I think the shortest I've seen to do a health checkup. When I compared it to what happens in somebody who goes to a clinic. So I think these are the three main features that I find of the accuracy is, like I already mentioned, is one of the highest that I've seen in any other device.
In the past few years, we have seen that there seems to be focus on treatment rather than people usually do not care about preventive care. They usually find if something happens in the future, they will go to the doctor and get the treatment done. So what are your thoughts on this? Why this is happening? What are the reasons that people are not focusing on preventive care rather than they are moving towards the treatment only?
First point of that is ignorance. They feel that if you have a health problem, you'll feel it.
Yeah.
Okay? Or something will show up. Like a light might glow in your thing, and then you can go to the doctor. Okay, that's the first ignorance part of it. The second part of the whole thing is denial. Because they don't want to go to a doctor who will label them as having some problem. So the whole aspect of prevention actually is wrong. In healthcare, there is no word called prevention actually, but it has been used for ages for now. It is more interception. It is about understanding if you are on the right path or not. So that's why I feel prevention has to be more a habit rather than something that a doctor or somebody should tell you.
Got it. So that was quite insightful, and hope to see you again. Thank you for sharing your feedback.
Thank you.
Thank you.